One of the most important parts of fixing any problem is making sure that you're fixing the right problem, right? You take in your car, you want to make sure that you're identifying the right problem. That's why you go through that whole process of explaining the weird noises it makes or what happens when you're driving and what lights are on. Or when you go to a doctor, you're talking about lab work and symptoms and getting exams and maybe even some imaging. Now, for sleep apnea, this is a very common question I get, even people who have gotten two sleep studies, because it can be very hard to accept that you're feeling tired and then you go to a sleep lab and now it's saying you have severe sleep apnea. You should go get life insurance. Everyone's not going to be like that, of course, but there's a lot of skepticism around sleep apnea, and there's also a high barrier, if you will, to really knowing like 100% for sure. Okay, a lot of air quotes around that because a sleep study in a lab may always not be feasible. Seriously, like sometimes out of pocket, it can be like $5,000, like even if you have insurance. Okay, and if you're lucky enough to have it fully paid for, you will be waiting months for that. So I want to give you all a range of different ways to look at answering this question. How do you know if you have sleep apnea? So we're going to start with just the quickest, easiest one. All right. This is this is completely made up. The PECAS diagnostic, we'll call it 23.2 version. Basically, you're snoring, you're waking up with dry mouth, you're tired. That's probably very likely to be sleep apnea. Okay, end of story. Now, this is a longer video for a reason, because there's actual research validated tools that are out there. So let's talk about one of the most common ones to start off with here. So it has this wonderful, wonderful name called, let me zoom out a little bit so you can see the whole thing. Um, let me see. I can zoom all the way out here. It is called the Stop Bang Score for Obstructive Sleep Apnea. And if we pull up some of this paper here, so again, go check my references, Journal of Sleep Science, here we go, 2021 article, and it's talking about how are these screening tests in patients and how do these correlate to a very rigorous, intensive gold standard of going to a sleep lab, getting a bunch of things that monitor your breathing, your pulse oximetry, your brain waves, and all of that. How does that compare to that? Because again, if you can just answer 8 questions, do you think that might be a little bit more convenient than sleeping overnight at some facility and charging your insurance $10,000, $15,000 and having to have a sleep medicine or pulmonologist? Really, family medicine can do it as well. Someone read over that study and then get back to you in 3 to 4 weeks. Could this be easier? So when we actually look at, I'll try to keep things pretty light here. There's a few surveys. We're going to talk about the Stop Bang here. We're going to do it live. And what you would want to know is basically how effective are these? Okay. And let's see here. When we look at sort of we won't get into sensitivity and specificity, but effectively you see some pretty good numbers. Specificity is going to be more important for the Stop Bang and something known as the Berlin survey here. Stop Bang is the easiest and it's also accessible here. It literally, if you just Google Stop Bang and MD Calc, this will come up. And effectively, it's just a series of questions. So if you snore loudly, you get +1. Do you feel tired during the daytime? All right, +2. And you see here on the bottom, it will translate into a nice score for you. And then you can just rack up some more points. So if you're a man, go ahead, give yourself a point. But going through this in linear sequence, if someone's seen you stop breathing or if you've recorded yourself snoring a lot, you can go ahead and put that there, or recording cessations or pauses in breathing. If you have high blood pressure or if you're taking medication for that, if you are basically 40 pounds overweight, that'd be the easiest way to calculate this. And you just add all these up, and then it'll tell you what your risk is. Okay. Now, again, this is going to capture, what did that say? About 68% of the time. So, obviously, if you had a test at school or something, 68% isn't something to put on the fridge. So, there's going to be other ways that you want to substantiate this. Okay, because again, you could totally go to a sleep study, you could totally go get that done, but here's the thing. Sleep studies capture one snapshot in time. How did you sleep one night at a place that wasn't yours? So let me talk about my first sleep study a little bit. Effectively, when I was going through my issues, sleeping awful, like waking up every single 90 minutes. I went to a sleep lab. It was some of the best sleep I have ever gotten, despite wearing electrodes on my head, having some nasal cannula up my nose, and a bunch of stuff all over your fingers and some other motion sensors and EKG. Despite all of that, I slept really well. So I actually had to get a second sleep study because I was like very adamant. I was like, hey, this is not how I sleep. So just by nature, yes, it is a golden measure, a golden standard of measuring and diagnosing sleep apnea. But at the same time, when you measure something, you want to be very clear what you're measuring. So for sleep apnea, you're measuring one night at somewhere that wasn't your typical sleep environment, not your typical routine. Whereas the survey instruments, okay, stop bang being one of them, the Pittsburgh Sleep Quality Index, although stop bangs can be the most specific for sleep apnea out of those ones I mentioned. These are going to give you a bigger snapshot over time, okay, as opposed to just one night. So that's really important in terms of being able to be a bit more accurate, okay, and also a lot easier to do because you can take this and use other tools to increase the likelihood of being very, very certain that you have sleep apnea, obstructive sleep apnea. Okay? Because here's the thing, this is really super duper important. You do not necessarily need a sleep study to confirm the presence of obstructive sleep apnea. Okay? There's other ways. You definitely need a sleep study to get insurance to pay for your CPAP or surgery or whatever else your healthcare provider may suggest. Once again, though, there's a lot of tools. There's these surveys. We're going to talk about pulmonary lung function tests. We're going to talk about all sorts of things that are not a sleep study in a lab somewhere. All right. So we have the stop bang, something can be very, very useful for you, or also maybe someone you know. Okay. Sometimes it's partners, their partner snores, etc. This is something you can fill out on their behalf. Then there's other things you can do as well. So we won't get all the way into this one, but effectively this paper is about the predictive value of pulmonary function tests for sleep apnea syndrome. I will skip you all this lovely information, just kind of tell you the main point of this article is that you can predict. So what they did, they got people and they did sleep studies on them and they did these pulmonary function tests like how much air can you take in, how quickly can you breathe it out, all these different pulmonary function tests. Okay. And they saw okay, how do these match up? Because if you can just do a simple blow into this tube or hold your breath, and that tells you have sleep apnea, again, we can save ourselves a horrible sleepover and a bunch of money, insurance, and delaying your results. You could. Okay. Again, insurances are only going to take the sleep study for the most part. But you can still do other things like for yourself, lifestyle changes, breathing exercise, etc., just by knowing this. Okay. So, just a disadvantage, the downside of this, obviously, you're not going to have pulmonary function test device at home. But there is one thing that is predictive. Okay. And it is known as measuring your respiratory loop gain. Okay. Again, this is something you would measure, say, in a pulmonology setting or the office. But you can do this at home. This is something I talk about often. Measuring something known as your relaxed pause. Okay. That is a function of how quickly your body wants to start breathing again in response to carbon dioxide levels going up. This is similar to respiratory loop gain, which is a parameter they measure in this study and similar studies. And effectively, so you just inhale, exhale, and then you pause your breathing. And then how long it takes you to have the first urge to breathe. This is not a maximal breath hold, but the first urge to breathe. That tells us what is your respiratory loop gain. The less you can hold your breath, okay, the worse this is. And the higher likelihood you have of having sleep apnea. Okay? So we'll do that again. So relax, pause, inhale, exhale, and pause. 1 Mississippi, 2, 3, 4, 5, 6, 7, 8, 9, 10. I'll go to 15, 12. I skipped 11, 13, 14, 15. I skipped 11 because we already went over it time-wise. Effectively, if you're below 10, and again, you're having, whether it's snoring, you're exhausted all the time, those two together will be highly suggestive of you having obstructive sleep apnea. Okay? And I want to take a quick tangent to say that for central sleep apnea diagnoses, sleep studies are a lot more necessary than for obstructive. Okay? Back to the obstructive strain here. So that's another measure you have. Another measure is also overnight pulse oximetry. All right? That is simply measuring how do your oxygen levels change at night. This is one of the parameters that is measured during a sleep study. Okay? But the thing is, if you know and can like bring these different sort of viewpoints, they stack together in terms of increasing the probability that there is obstructive sleep apnea present. So again, you could do a stop bang. You could go ahead and that's not what I want to bring. Do that little pulmonary function test that I just did, or you can go to your pulmonologist. That also works as well. So that's two things. And then the third one would be some overnight pulse oximetry, which sometimes is very overnight because all you got to do on Amazon, you can get any one of these devices. They're like $99. Put it on your finger. It can hook up to your phone. Some of them just record data directly onto the device. You look at that, and if you have a lot of drops or oxygen desaturations, when your oxygen levels go down, if you're having those drops and they're greater than, say, like 4% and happening many, many times an hour, probably over 5, over 10, pretty much the higher it is, the more likely you have obstructive sleep apnea. That is going to be another indication that obstructive sleep apnea is present. Don't need to go into a lab. Okay? So, again, this is suggestive of it. Okay? Because at the end of the day, ultimately, it's someone signing off on a piece of paper officially diagnosing you with something. Okay? Because you can have all the different scans, all different things, but at the end of the day, it is a clinician looking at many different factors and variables to suggest and even formally diagnose the presence of any condition in someone, including sleep apnea. So these are a lot of different parameters available. And another thing I want to talk about is when we're using these tests, okay, because you want to use each one in a way that helps you increase your probability of you knowing like what is going on, right? You can certainly skip all the way ahead to a sleep study. Okay, great. That's convenient for you and works out. But again, like I said, you can also stack these things that may not be as accurate or as strongly predictive as the gold standard, but are way more convenient. Like all these things you can do. Again, the survey, the breathing test, the overnight pulse oximetry. You can do that in like the next 24 hours. Okay, with Amazon same day shipping. So it gives you a lot of great things because yes, you may need a gold standard uh, diagnostic test to then get approved for a CPAP or surgery. But the thing is, you can start to do things by yourself even before that, right? And then you can also use these metrics to track over time, okay? Because anytime you get some sort of data, you need to be able to make decisions with it. So that's why I really am an advocate for tracking in many different ways. Because there's many different things we can get into, whether it's tracking with your snoring with an app like Snore Labs or Sleep Cycle or Shut Eye. Any of those will, I mean, they're basically all the same thing. Um, and that gives you another data point. Because then if you're doing, say, things by yourself, again, whether it's like changing the position of your pillow, the incline of your bed, uh, making sure you have a good sleep environment, you can see how that then impacts these parameters of sleep apnea. Because guess what? If you're doing things at your own home, and then you're, retaking the survey, you're redoing the breathing test, you're tracking your oxygen levels at night, and those are going in the right direction, you're doing some good for yourself. Because a lot of times we'll have clients who they have this like, they're like, oh yeah, I finally got in with my sleep doc. The appointment's in like 8 months. Okay. Are you gonna wait 8 months and then get a sleep study and wait like 3 more months to be told, yeah, you don't sleep well? You can do things before then. I'm not saying it's gonna turn everything around, but you can certainly have the power in your hands because we have clients who they see their PCP, their primary care doctor. There's that big lag time. They're doing things, and by the time they get to the sleep medicine person, they're like, well, uh, I don't think you even need a sleep study. Just keep doing what you're doing. All right. So that's why I want to be able to like kind of demystify a little bit of classifying someone with obstructive sleep apnea. I know we didn't get into the exact criteria of you need to have more than five, you know, apnea or hypopnea events for more than 10 seconds, more than 5 times per hour. Like that's not the exact point of this, but be able to put tools in your hands so you can know like what is the likelihood you have the condition and how can you use these things to track over time, and then how can you get yourself moving in the right direction. Okay, so we'll skip a lot of the other statistical pieces here because I'm not sure it's going to be very serving to anyone, but just know there's a lot of different ways to increase your certainty of knowing if you have sleep apnea or not. Okay, I did have a paper on biomarkers, but we can just kind of skip that because again, it falls into the same category. And also, like these are research biomarkers. You would have to pay like thousands of dollars to even get this tested. All right, so that's how you can check in if you have sleep apnea or even confirm it. Because I know again, a lot of people are suspicious. Their doctor is just like, "Do you snore? Okay, I think you have sleep apnea." And I know I had the same thing in the beginning. But honestly, by the time someone comes to me, it's not their first time talking about this, so I'm just kind of hey, yeah, you have this issue. That's why you're here. That's why you did all the things. So thank you so much for watching. And again, of course, if you want to be able to get a high level of help with your sleep apnea, then what you can do is go to ochnow.com/talk. There's a link. Just fill out a short application, short intake form, and then you pick a time and date, and then we just talk about what's going on. That's basically all that is. You'll see this form here. That's as simple as it is. So thank you so much for watching, and I'll see you in the next one.